concludes the opening remarks portion of today's media briefing. I'd like to turn it over to start with the Q&A portion. It'll be one question per media organization with a follow-up. So I will start this part of the media briefing with Luke Carroll from CKLB. Luke, are you on the line?
Yeah, I'm on the line. Can you hear me?
We can.
Yeah, perfect. So a question for Dr. Kandola. I'm just wondering if the rapid testing machines, I remember a few months ago you talked about how that might, that you were considering using that to shorten the isolation stays. I'm wondering if that's still something you're considering, if that's something that's going to happen. Thank you.
So we have point of care tests or rapid tests available in most communities. We have the ID now is a molecular test, and we have PANBI, which is an antigen test. Where they have been useful is actually diagnosing symptomatic residents in those communities as quickly as possible while we wait for further validation. The rapid tests is a useful adjunct, again, for symptomatic. We have not yet used it wholesale for screening per se for travelers coming in. Because of the variants of concern and because they're so easily infectious and they could be resistant to the vaccines, it would be prudent at this point in time to continue with a full 14-day self-isolation until we see what happens in the rest of Canada in terms of if they go into wave 3, how they're going to roll out the vaccine program, and also if these variants of concern become predominant. We can't afford the chance of having people leave on day 10 and then develop an infection that can be passed on because we know how much more easily transmissible variants of concern are.
Luke, do you have a follow-up?
So on the Fort Simpson and Norman Wells, allowing people to self-isolate there, are there any other communities that will get this opportunity going forward as the vaccinations continue?
Communities have to have a host of different factors that come into play. The Fort Simpson and Norman Wells are regional centers, so they have additional medical capacity to, if there is an outbreak or if they have to stabilize a sick patient, they have that capacity. They also have wastewater surveillance capacity. They have compliance officers on site. They have the ability to isolate cases if they in the community, and there's been a good uptake of the second dose vaccine. So all these factors put Fort Simpson, Norman Wells in a really good position to allow direct self-isolation in those communities. If there are communities that are interested and there's capacity, they can always reach out and we can talk to me and we can look at do a public health risk assessment and see if what they need to do to be ready and to be able to have people isolate directly in their communities. But it is a conversation that requires a risk assessment.
Thank you, Dr. Kandola. Next, we have Ollie Williams with Cabin Radio. Ollie, are you there? Okay, I guess we'll just move along and hopefully Ollie can get back online. Next, we have Thomas Ethier for Radio Taiga. Thomas, are you there?
Yes, sorry, can you hear me?
Yes, we can.
Perfect. So my question is for Dr. Kandola. I guess we just need an update on the Emerge Wisely plan. It's a question that is asked pretty often. But now, given the progress on the vaccination campaign, very general question, what will it take to move to step 3, and when could we expect it?
So We are rolling out the vaccines, and this week is a heavy week in terms of vaccine rollout. We're rolling out to most communities except for Good Hope. And so we need to look at what the uptake on the vaccine is. We're hoping to achieve at least 75% of our eligible population with 2 doses. That would provide a very good protection for the NWT. We would achieve peak immunity 2 weeks after the 2nd dose. So the time period where I would be considering moving into phase 3 would be later on in the spring, depending on our vaccine uptake and how many people have taken the vaccine that aren't fully immunized. But it will be April, mid to late April, when people would have been receiving the 2nd dose. And so we will be taking that into consideration, expecting a large uptake, and moving forward into relaxing of the public health measures.
Great. Thomas, do you have a follow-up?
Yes, a follow-up. Would you say acceptation or maybe the fear, hesitation in the communities facing the vaccine could be a factor that could lead to moving or not to step 3?
I think we'll get more information on what the uptake overall for NWT is, and we're still expecting the 5th shipment, and we haven't opened up the general population yet for Yellowknife, Hay River, and Inuvik. We will be taking many factors into consideration, including vaccine uptake. The travel restrictions will still need to be in place. We need to be looking at what's happening in the rest of Canada if we've moved into a wave 3, what their vaccine uptake is. But we've had 44% of our adult population have received at least 1 dose, and that's before our heaviest week. So I am confident that we're going to get a significant vaccine uptake. For those who are vaccine hesitant or need more time, we will provide specific communication to that population. But I feel even with the amount and where we're heading right now, I'm pretty confident that we will be moving into a step-by-step phase 3 approach in the spring.
Thank you, Dr. Kandola. Natalie Pressman from Northern News Services. Are you on the line?
Yes. I have a question for Dr. Kandola as well. I suppose the 2nd dose clinics being completed in these 2 communities doesn't include the under 18 population. So I'm just wondering if you could tell us which other groups that it maybe doesn't include, and if there are any updates on the prospect of those populations being vaccinated.
So it is correct that currently the Moderna vaccine, which is the vaccine that we use in the Northwest Territories, is eligible for 18 and older only. But we do know that the Moderna company is undertaking a trial with 3,000 children between 12 and 17. And we're confident that we'll get the information based on that trial. Hopefully that will allow us to open up vaccinations to the under 18, because you are correct, it is it is an unimmunized group, and we need to take that into consideration in terms of not putting schools at risk, because even if we open it up to all adults, we want kids to continue their schools. We don't want schools closed because of outbreaks. And so we need to factor that into our phase 3 considerations. But I am also optimistic that as the trials are completed, hopefully before the summer, that we'll get some really good data that we can open up vaccinations for that specific population before the next school year starts in September. So that if the data shows that children can be immunized, that it's safe and it's efficacious in that population, then we can immunize them over the summer. And when the next school year starts, they can actually start school fully vaccinated. With respect to your other question, whether the populations are not eligible for the vaccine, it would be anyone who has serious allergies to ingredients in the Moderna vaccine. And the one ingredient is the PEG, it's polyethylene glycol, and you can find it in cough syrup, in contrast media, in contact lens solution. So if people have a known allergy to that ingredient, a severe allergy, they would not be eligible for the vaccine. We have opened it up to people who are immunocompromised or are taking medications that decrease their immune response. That's been, by expert opinion, that population has been opened up to receive the vaccine. And they're pretty much, it would be people who are allergic to the vaccine, who are under 18, and who are vaccine hesitant. So a very narrow group of people.
Natalie, do you have a follow-up?
Yes, I was just wondering, for those people who have that allergy, what maybe can you tell us about how they're going to be protected and sort of what the prospect is of them getting vaccinated in the future?
The good news is that the messenger RNA vaccine, Moderna, is not the only vaccine that's on the market. Right now, we have Pfizer, which is being used in the southern provinces. AstraZeneca was recently approved, and Health Canada is now looking at the Johnson & Johnson vaccine. And there is another vaccine that Canada may be making within Canada. I believe it's the Novavax vaccine. Has spring and summer unfold, we'll actually have a lot more choices. And so for those people who are specifically allergic to ingredients of this current vaccine, we will have more options to protect them in the future as these vaccines roll out.
Thank you, Dr. Kandola. I'd like to see if Avery Zingle from CBC or another reporter from CBC is on the line to ask any questions.
Sorry, Andrew, it's Garrett Hinchy from CBC. Can you hear me?
We can, Garrett. Thanks so much.
Great. So this is a question for either Dr. Kandola or Premier Cochrane regarding the announcement today about Fort Simpson and Norman Wells. I'm wondering, in terms of how the decision was made, was this something that was requested by the communities? Regardless, I'm also just wondering if you could maybe expand a bit on how that consultation process unfolded as you guys decided to make this decision.
Sorry.
Yeah, if you can start with perhaps Dr. Kandola talking about the consultation, and perhaps I can talk about the follow-up calls that happened before today.
So it's been 11 plus months, and we've been reviewing exemption requests for people to want to isolate directly in the community. We've received a significant number of exemptions requests for Fort Simpson and Norman Wells. And for exigent circumstances, we also do require that they notify leadership. We have received correspondence from some of the community leaders of wanting to move into this direction. What we were waiting for was, we knew we had the regional capacity, but the wastewater surveillance has only been recently implemented in Norman Wells, and we find wastewater surveillance has been an excellent tool that we've actually used in Hay River and Yellowknife to actually prevent community spread. And so it gives that additional reassurance and decreases the public health risk. And finally, the last thing we were waiting for at this point was for the second dose vaccine clinics to roll out, and they will be completed as of the end of day today. And so with all those factors, having the medical capacity to deal with outbreaks and to stabilize sick people, having the capacities have cases isolated separately from their family, having compliance enforcement officers in those communities, wastewater surveillance collected twice a week, which covers the full week, and then having the second dose vaccines rolling out, and knowing that we had a good uptake for Norman Wells and Fort Simpson. We felt that they were ready, that from a public health risk assessment point of view, they're fully ready to have people isolate within their communities. We have enough tools on our hand. We also have rapid testing available in the community so we can test people who are symptomatic. That they have, this is a decision that was made with looking at all these different factors, and from a public health point of view, the risk can be mitigated, and they're fully capable of being a direct isolation community. Thank you.
Okay, Premier Cochrane.
Thank you. So it's really important that we work in partnership. I've said it many times, the government of the Northwest Territories can't do this alone. We've been working closely with the leadership right across the Northwest Territories, the mayors, the chiefs, etc. And so in honesty, late last night, I actually phoned all of the chiefs and Grand Chief Norwegian, SSI Chairman McNeely, all the applicable chiefs and both mayors from both communities. In general, they were all ecstatic. They know that their residents have been asking to be around their families. There's something important. Like I had said earlier, we've been in this almost a year, and people are past COVID fatigue. They're COVID exhausted. So being able to open it up will help a little bit with the mental health issues that we are seeing across the Northwest Territories. But one concern that was brought up is what happens if people don't obey? So as Dr. Kandola said, we have task force members in both communities. All of the chiefs, all the leaders, the mayors, etc., have my personal cell phone number. I've given them my guarantee. If they have any incidents, phone me, call me, and we will be at the door. We will be there for them, as we are in Fort Liard. The one concern that was brought up is what are the requirements? So any person that is approved to self-isolate in those two communities, they still have requirements. They need to file the self-isolation plans. They need to abide by the 14-day self-isolation, and they can't travel to any other communities, and they can't be in the public. So the same regulations that are here in Yellowknife and their regional hubs are the same that will be in those communities. So, but in general, the communities were ecstatic. The leadership is really excited that their people can come home. And I think that is for the mental well-being of all of us. I think we all want that. Thank you.
Thank you, Premier. Garrett, do you have a follow-up question?
I do. Thank you both. This question is for Dr. Kandola, and it's regarding the revised guidance that was put out yesterday by the NICI that's now recommending up to 4 months can be taken between the first and second dose of the Moderna vaccine. I'm just curious how that impacts the Northwest Territories vaccine plans at all, or if at all, sorry.
So for the southern provinces, this was welcome news that they can wait up to 4 months. But even the Northwest Territories, it is kind of welcome news. We have a lot of our residents who are traveling out. Were very some of the common questions I would get is, we can only get our first dose, but we're traveling now, but we won't be back for another 3 to 4 months. Well, now we can say with the National Advisory Committee on Immunization, with the national statement is, don't worry, you can get the first dose, and the second dose will be waiting for you when you come back. You can still get that. We also know that for our vaccine rollout, that we ensured that everyone who got their first dose would get their second dose within their 28-day to 42-day window. And we're still maintaining that schedule. But with the data, the strong data showing strong immunity, with one dose, strong immunity even up to 2 months, we know that as time passes, that with this information, what we're going to be seeing is that the first dose actually maintains immunity for such a longer period that we can we don't have to be so stringent on the time frame of the second dose. However, for all the communities out there, we're still delivering the second dose within the 28 to 42 day window. For all those people who didn't want to get a first dose vaccine because they weren't going to be available in that time period because they're going to be traveling out, please get the vaccine. We will have that vaccine waiting for you when you're ready.
Thank you, Dr. Kandola. And last, we have Mario DeCiccio from Radio Canada on the line. Mario, are you there?
Yes, I'm here. My question is also for Dr. Kandola. Will you be providing the public with more detailed information about the vaccination rates in communities and, well, in all the territory and in communities? Like, will we know how many people have been vaccinated in Fort Simpson, for example? I think I asked this question maybe a couple of weeks ago, and I think you said something around the lines that more detailed info could come with the second doses. Now that we're there, will we get that info?
So right now, our main focus is try to roll out as many vaccines as possible, first doses and second doses. We're reporting on the total number of doses of dose 1 and dose 2, and you can actually see that on our dashboard. Once we've had the opportunity to provide everyone in WT the opportunity to get the vaccine, and we have the second dose vaccine numbers, we can actually provide more solid numbers and coverage and do the validation. The main thing that we're looking at is capturing denominators. So we have the number of doses, but it's very important that we get the right denominators for communities, and that requires time. We will do that deeper analysis once we roll out all the vaccines, and then we'll come back with something solid. It's really important for us to also provide those specific coverage rates to the actual community leaders in the communities, and then we'll look at how we'll roll it out for the public, whether it be regional coverage or community coverage. It depends on what we can and what we can't share at our private details, as some communities may be very small, but for sure we can get regional coverages, and that will be provided when we get all the vaccine doses come in, first and second dose, and we can actually know how many people fully vaccinated. The time is not right now. Time right now is to try to roll out as many vaccines as possible.
Mario, do you have a follow-up?
Yeah, then can you maybe just talk about, do we know how many, now that we're going through the communities and giving the second doses, are you able to provide we're giving during those the second doses distribution? So how many people came, to the vaccination clinic getting their first doses?
Mario, I'm sorry, you kind of cut out. Could you please repeat that question?
Yeah, basically, I'm just asking, since we can't really have these numbers, are you able to provide numbers on how many first doses were given during the second doses distribution that you're doing right now in communities? Yeah. Like, are there a lot? What sort of details can you give? Yeah.
So not specifically community level, but once a week we do publish on our COVID dashboard. We've given 15,217 first doses, and 4,558 NWT residents have received the second doses, so are fully immunized, and we've vaccinated 44% of our adult population. We will continue to roll out these first and second doses, and then the information will be validated and sorted out later. Right now, we can't, when we go into communities, there may not be everyone from that community there. There could be people visiting from another community or a mix of people. So we can't use how many people came for the second doses and say it belongs to that community. It actually needs a deeper level of analysis and separation. And so that analysis will happen later once we get all the doses come in. But right now, what we can provide you is every week we can tell you how many people received their first dose and how many people have received their second dose. That is done on a weekly basis.
Thank you, Dr. Kandola. That concludes the end of our media briefing today. I want to thank Dr. Kandola and Premier Cochrane for attending, and to the media for being here as well. If you have any follow-up questions related to today, please reach out through the regular channels and we will do our best to get back to you in a timely manner. Thanks everyone, and have a wonderful rest of your Thursday.
Thank you.
Thank you.
Thank you.
All right, thanks everybody.